Well, fewer people will get free flu shots in Ohio this year. That's because the state health department is purchasing about 70,000 vaccines or fewer vaccines this year than last. Local health departments across the state try to fill the gap for people who are uninsured or underinsured, but they're also feeling the pinch from Ohio's recent budget cuts. The local health departments can still buy the vaccines on their own to sell to non-high-risk folks or people with insurance. But some doctors fear their working poor will miss out, which could cause problems. And we're going to talk about the flu and the H1N1 flu and also other vaccines that kids have to get this year for school. And joining us this morning is Dr. Michael Sevilla. He's the Chief of Medical Staff at Salem Community Hospital. Good morning.
Good morning. All right.
Tell us, let's start off with flu this year. Flu vaccines, H1N1 vaccines, or Tamiflu are big this year. Tell us exactly what parents need to know about these.
Yeah, there's been a lot of recent stories about H1N1 or swine flu and what that's going to be all about. We don't really know much yet. We've heard that something may be coming out in the fall, and what that may be is a kind of a two-shot series, but we're not definite about that yet. But probably most important is the regular flu vaccine to get that shot, and that's indicated even to kids all the way down to 6 months of age, the regular flu shot.
Now, moving on to a different topic is just vaccines for meningitis and other things like that. Should students be vaccinated for these things before they go to school? Because a lot of parents these days are choosing not to vaccinate.
Yeah, there's a lot more vaccinations, especially in the adolescent age group, even going down to ages 11 and 12, starting with the meningitis vaccine. And I remember almost 10 years ago the outbreak at West Branch High School with the meningitis there, and that's when a lot of the community got educated about it. And of course, you know, the college students get the meningitis vaccine as well. Another thing that I get a lot of questions about is the Gardasil vaccine or the cervical cancer vaccine, and that's indicated at ages 11 and 12 as well, and that's a 3-shot series. And there's a little bit of controversy when that first came out, but it does prevent cervical cancer, and I advocated for my parents and my patients that it is a good vaccine.
And I'm sure a lot of people a lot of parents are concerned because giving their daughter the vaccine makes them seem like they're sexually active or whatever like that. That's the biggest concern. Is that right?
Yeah, that was the concern when it came out. But we do have good scientific data that the Gardasil does prevent cancer, cervical cancer, and yeah, I advocated for my patients to get the Gardasil vaccine.
Now, along with that, though, you have to make sure that you get it before a certain age. Is that right, or it doesn't work?
Yeah, because the Gardasil exposes the patient to the virus, and they're saying, you know, maybe in the mid-20s or later 20s that people would already be exposed to the vaccine, so it may not be as effective in the you know, late 20s or early 30s age group.
And August is a special month. Tell us about that.
Yeah, the Centers for Disease Control, the people that make the vaccine recommendations, have designated August National Immunization Awareness Month, which is perfect for back to school.
Yes, very good. Thank you, Doctor. We appreciate you stopping by and talking about this morning for us.
Thank you.
Thank you.